Joint Commission.
Thank you. It's an honor to represent the Joint Commission and provide testimony at this important town hall. As the Chief Operating Officer and Chief Nurse Executive, my daily work focuses on quality and safety. As a nurse, I feel fortunate that our work at the Joint Commission is connected directly to the important work that nurses individually and collectively have on the health of individuals and the communities they serve. In preparing for this testimony, I found the parallels between the mission of the National Academy of Medicine and the Joint Commission and the considerations of the future of nursing for 2020 through 2030 to be striking. We collectively strive to improve health care for the public and provide independent, authoritative advice on ways to do this. We see the role of the nurse as critical to assuring that the voice of patients, families, and communities are represented in our efforts to improve health care for all. Just to provide a short overview of the Joint Commission, we're an independent, not-for-profit organization that accredits and certifies over 22,000 healthcare organizations and programs in the United States. As the oldest and largest healthcare evaluation and accreditation body, the Joint Commission has always worked through research roundtables, expert panels, and other collaborations on the provision of safe, high-quality, and equitable care. This focus is reflected throughout our standards, for example, our rights and responsibilities of individuals and our survey process activities. We are also an organization of hundreds of nurses and other disciplines who work in many different roles, including research measurement, high reliability, and on-site evaluations of risk, quality, and safety. Although we accredit healthcare organizations, our mission begins with patients. We believe that each patient is unique. In addition to their individual clinical concerns, patients bring specific characteristics and non-clinical needs to every healthcare encounter across their continuum. These specific characteristics can affect the way they view and are viewed, receive, and participate in their healthcare. Research continues to demonstrate that a variety of patient populations experience less care or poorer health outcomes that can be associated with their race, ethnicity, language, disability, or sexual orientation. We find this in stark contrast to our mission and vision. We believe a partnership between the Joint Commission, our accredited organizations, and nurses is critical to making changes that ensure improved health outcomes. The question is, how do we do this? One example that I can share with you how it works at the Joint Commission. A May 2019 report from the Center for Disease Control and Prevention stated that approximately 700 women die from pregnancy-related complications in the United States each year. Approximately 3 in 5 pregnancy-related deaths were identified as preventable. In addition, the report stated that African American women were over 3 times more likely than white women to suffer a pregnancy-related death. Native American and Alaskan Native women were over 2 times more likely to die from causes related to pregnancy compared to white women. That same day, a New York Times article addressed the huge racial disparities found in deaths linked to pregnancy. The United States was reported as having, quote, an abysmal record of maternal health compared to other high-income countries, unquote. This data is of critical interest to the Joint Commission. Our Division of Healthcare Quality Evaluation is looking beyond our current standards, and after a period of public comment that ended in May, we will be publishing new standards for maternal hypertension and hemorrhage later this year. Once finalized, these standards will be included in our surveys assessing healthcare organizations for their risk, safety, and quality. The Robert Wood Johnson Foundation study told us nurses want better outcomes for their patients and that they perceive the organizations they work in don't necessarily support this. The Joint Commission wants to help change this. I would refer you to the Joint Commission website, jointcommission.org. Just a few examples is the work that we've done on advancing effective communication, cultural competence, and patient and family-centered care for the lesbian, gay, bisexual, and transgender community, implicit bias, use of opioids, and the Joint Commission Speak Up campaign in English and in Spanish, encouraging patients and families to take an active part in their care. In closing, we at the Joint Commission are committed to advancing the nursing profession to help our nation create a culture of health, reduce health disparities, and improve health care in the United States in the 21st century. Thank you.
Thank you.